What if your bones could actually talk? Well, in a way, they can. So today we're going to play detective, and we're going to use the power of radiology to decode the secret stories hidden deep inside the human hip. I mean, just think about it for a second. A high-speed car crash, a runner who suddenly feels this sharp, painful snap, or a patient whose new hip replacement is causing all this unexpected pain. See, these aren't just medical issues, they're puzzles. And the clues? They're locked inside the bone. So the question is, how do we actually find those clues? All right, let's start cracking the case.
Okay, so every good detective starts with the layout of the crime scene, right? For us, that means we have to understand the fundamental blueprint of the hip socket.
So right at the heart of this whole thing is the acetabulum. That's the hip socket. Now, it might just look like a simple cup, but it is a marvel of biological engineering. Its strength comes from two columns of bone that merge together into this really distinctive inverted Y shape. And believe me, this Y is the key to everything that follows.
So let's break down that inverted Y for a second. It's formed by two completely distinct supports. You've got the front, which is the anterior column, and the back, which is the posterior column. Now, here's a great little trick to remember which is which, and it comes from the ischium. That's the part of your pelvis you're probably sitting on right now. Since you sit on your ischium, that tells us the posterior, or the back column, is the one that's connected to it. Simple, right? But incredibly useful.
But what happens when this beautiful structure fails? Sometimes our own bones can kind of betray us. Fractures and dislocations aren't just injuries. It's like a crime scene, leaving this trail of radiological clues for us to follow. Okay, here's a really fundamental rule that changes everything depending on the person's age. In adults, bone is stronger than tendon. But in kids, it's the complete reverse. This one simple fact explains why kids get this very specific type of injury called an avulsion. So, in an avulsion injury, a super strong tendon literally rips a piece of bone clean off. For a radiologist, this is like finding a calling card at the scene of the crime. By knowing exactly which muscle attaches where, like the hamstrings at the ischial tuberosity, they can look at a tiny little bone fragment on an X-ray and know precisely which muscle was responsible for the damage. But, and this is where it gets really fascinating, if an adult suffers what looks like an avulsion of the lesser trochanter from just minor trauma, it sets off major alarm bells. And you gotta ask, why? Well, because an adult bone should just be too strong for that to happen. It makes radiologists think of one thing immediately: a pathologic fracture, which is often caused by cancer weakening the bone from the inside out. Context is just everything. Okay, let's move on to something a bit more dramatic. Hip dislocations are often called dashboard injuries because they happen in car crashes. The femur gets driven backwards, causing a posterior dislocation. And here's a key clinical buzzword you gotta know. The telltale sign for the clinician is that the patient's foot is stuck in internal rotation. That's a major, major clue before anyone's even looked at an X-ray. High-energy impacts, like the ones from major accidents, create what we call unstable pelvic fractures. And the exact pattern of the break really depends on the direction of the force. But here's the thing. In these cases, the broken bone isn't even the biggest worry. It's the risk of tearing a major artery. This can turn a fracture into a life-threatening hemorrhage in like seconds. Right, so not every case is some dramatic break. Sometimes the mystery is a lot more subtle: a strange snap, a weird click, or a nagging pain that just won't go away. Those little sounds, those are our first clues that maybe, just maybe, the problem isn't the bone at all, but the soft tissues around it. The hunt for snapping hip syndrome is a perfect example of this methodical detective work. It's a step-by-step process. First, you start with a clinical exam, trying to actually feel the IT band snapping over the bone. Then an X-ray helps rule out any issues inside the joint itself. If that comes up clear, an ultrasound can literally watch the iliopsoas tendon snap in real time. And if the mystery still isn't solved, an MRI arthrogram is the final step to find those hidden culprits, like labral tears. All right, another really common mystery we see is something called femoroacetabular impingement, or FAI. That's a mouthful, but it just means the bones of the hip are shaped in a way that causes them to pinch each other. So the detective's first question is simple. Is the problem with the ball, or is it with the socket? A cam type means there's an extra bump on the ball, which we see a lot in young athletes. A pincer type means the socket is too deep and it overcovers the ball, which is more common in middle-aged women. So how do radiologists spot a pincer type? Well, they look for something called the crossover sign. On a normal X-ray, the front and back rims of that socket, they don't cross. But when the socket's too deep, they do. And boom, this elegant little visual clue is a dead giveaway, confirming exactly where the patient's pain is coming from. All right, our investigation is now going to turn to the aftermath of a major upgrade, a hip replacement. These devices are truly incredible feats of engineering, but what happens when they start to go wrong? Sometimes the biggest clue is the tiniest measurement. When a hip replacement starts to fail, it can loosen from the bone. The key finding we look for on an X-ray is a gap right at that bone-implant interface. If that gap is greater than 2 millimeters, it's a really strong sign of what's called aseptic loosening. And that's the #1 reason someone has to go back for a revision surgery. Now, for a complication that's going to sound a little bizarre, over time, implants shed these microscopic particles, and the body's reaction can be, well, intense. As this quote puts it so vividly, macrophages will try and eat the particles and spew enzymes all over the place. This aggressive biological response is what we call particle disease. So what are the clues that point a radiologist to particle disease? Well, first, there's the timing. It's a late complication, usually popping up 1 to 5 years after the surgery. On an X-ray, you'll see these smooth, scalloped areas where the bone is literally being eaten away. And crucially, it's not an infection, so standard lab tests for inflammation will come back totally normal. Ironically, sometimes a problem happens because the implant is just too good at its job. A strong metal stem can carry the body's weight so well that the bone around it gets shielded from all that stress. We call this stress shielding. And there's this fundamental rule in biology, Wolff's Law, that basically says use it or lose it. So the bone gets lazy and starts to dissolve because the metal is doing all the work. Okay, for our final case today, we are hunting a phantom, a fracture that's often completely invisible on the first X-ray. To solve this one, we're going to need to look for a totally different kind of sign. We're talking about a sacral insufficiency fracture. It's a type of stress fracture in the sacrum. That's the big bone at the base of the spine, and it's most common in older women with osteoporosis. The reason this thing is so tricky is that it's often occult, which is just a fancy way of saying it's hidden on standard X-rays. So a doctor can look at the film, see absolutely nothing wrong, and meanwhile, the patient is in agony. So how in the world do you find an invisible fracture? Well, you have to use a more advanced tool, a nuclear medicine bone scan, and that's where you get this aha moment. The fracture pattern lights up in this super distinct H shape, and this classic finding, it's called the Honda sign. And yes, it's because it looks just like the logo. It's the definitive clue that solves the case. So there you have it. From the really subtle architecture of the inverted Y all the way to the super dramatic Honda sign. Every single one of these images tells a story, if you just know how to read it. We've seen how radiologists basically act as detectives, piecing together all these clues to solve some serious medical mysteries. The real question is, what story will you see next?